Hi, everyone. First of all, thank you to the Academy of Clinical Hypnosis for giving me this opportunity to present in their monthly meeting. So today I'm presenting a case study on accelerating emotional and cognitive learning in intellectually disabled young adult using hypnotherapy. So let me share my screen. Okay, hope everyone can see my screen. So I'm Dr. Sumita Chakraborty. I'm a psychologist, neuroscientist, certified clinical hypnotherapist practicing in Dehradun, India. So I have been trained in science for an extensive number of years, starting from a zoology honors in the Presidency College of Calcutta, followed by master's in molecular biology, and then a PhD in neuroscience from NCPSTIF Bangalore, and then several years of postdoctoral research in molecular neuroscience in the University of Cambridge, DBT-inStem Bangalore, India, and at the Weizmann Institute of Science, Israel. So while I was studying brain and the intricate details of neuronal connections, I was also dealing with a lot of personal emotional turmoils that was stemming from childhood trauma that I was not very aware of. I didn't recognize those as trauma, and also the fact that that could actually trouble us in our adulthood. So, if you have read the book, The Body Keeps the Score, uh, each traumatic memory, if not processed well, is stored in our body. And if we are not trained to recognize and process that, then there are also somatization that can happen. So, a part of the body starts to cry for us. So I had this thing, I had a shoulder pain, chronic shoulder pain for 14 years. I was going from clinic to treat the pain. And ultimately, when I came across hypnotherapy and tried it, especially this called Rapid Transformational Therapy developed by Maurice Pierre in UK, that experience for me was an eye opener. And I was already very interested in the functioning of mind, psychology, and the body and mind connection. So when I got the chance to become a clinical hypnotherapist myself, I did that. And I started helping my colleagues and friends to see amazing results. So upon return to India from Israel, I started practicing as a clinical hypnotherapist full time. And I also finished my master's in clinical psychology, and I wish to continue to do more to get licensed so that I can practice in all settings in India. So moving on, the therapy I'm talking about today is called Rapid Transformational Therapy. It's a battery which involves hypnosis and many other modalities of psychotherapy. So it starts with an induction and deepening session. We use Spiegel eye rolling movement, and followed by Freudian regression techniques that comes under detective work and daisy chaining, followed by understanding the role, function, purpose, and intention of, let's say, a physical issue or a habit, a pattern that is there to help us, having a secondary gain that we not consciously understand. So after revealing all the root cause, we then do cognitive reframing or restructuring, sometimes letting go of the old pattern or reframing it, giving it a new role, followed by upgrading and merging the inner child, then transformation, followed by neuro-linguistic programming. I also make a personalized audio recording for about 20 minutes to install the change. As we know that the mind learned by repetition, so the patient continues to listen to this personalized audio for a month to install the change that they have done in the session. So this makes them more independent of the therapist and they find control within themselves. So the idea of the whole therapy is to empower the clients, empower the patients with tools that they can continue to use and claim their life and be control of their own life. That's the idea. So these are short-term focused, solution-focused therapy. It lasts about a month. Excuse me. So we start with the discovery call to understand the fit. followed by an official onboarding process with the filling up of intake form, followed by the first session, the preparatory session, then a main RTT session, which lasts 2 to 3 hours, followed by the follow-up sessions to support the change that the client or the patient is going through, and then an official feedback form to understand what worked for them and what needs to be done more. So far in the last year itself that I'm showing you now, the data from last year. So I have worked with 105 patients where female was almost double the male, but still it was very nice to see male coming up, owning their emotions, sharing emotions, and doing the emotional work that is always considered as a feminine part of us human. Male coming up, owning that part, if there's any conflict, settling that, and then coming up with a more mature approach to life. That's very nice to see. Sorry, I have also worked with a varied range of age from 3 to 79. And these are the most commonly presented problems. So there's depression, motivation, procrastination, career issues, money blocks, top, followed by exam memory, confidence, self-esteem, relationship, childhood issues, eating problems, and hormonal problems, etc. Excuse me. So as I've mentioned, still there are more female than male seeking therapy and owning their emotions, understanding emotions. And there's a varied age group, but most people I have seen falls under 30 to 39, followed by 40, 49, 50, 59. But there are also quite a lot of youngsters in their 20s coming for therapy. I see patients from a large variety of professional settings, including scientists, researchers, IT managers, business owners, homemakers, students, etc. So far I have seen patients from 18 different countries and 63 different cities. So today I'm talking to you about a case. I'll call her Lisa. She's 26 years old, female, single, involved in marketing profession from Hong Kong. So she came to me with severe learning difficulty, mostly to work on self-confidence. So here is her evaluation. This was done a few years ago, and her IQ was then 68, falling under severe learning difficulty category. So when she came to me, I'm showing you the actual intake form, and she was struggling with a lot of anxiety, panic attacks, depression, confidence, self-esteem, pain. So she has developmental defects, so there was a lot of pain involved, hormonal problems, sleep problems, eating problems, and relationship issues, childhood problems. When asked what outcome did she want from the RTT session, she wanted a stable and healthy mental and physical health and to be pain-free. She also mentioned that she had a lot of suicidal thoughts, but she never attempted it. And she was already under psychiatric care. So I could onboard her. And when we went to the detective work, there are a lot of scenes that came up where she was bullied. She was told that she shouldn't exist. And all the time she was not eating. She was severely underweight. And she had this thought of killing herself because she believed that she had no space in this world, which was very tough to hear. So in her medical history, she was diagnosed with mixed depression, anxiety, and she had severe learning disability alongside expressive disorder and hypertonia. So she was on medication and she felt very anxious, and she also had difficulty in expressing her feelings. So I always ask people how committed they are to solve their problem. So what I mostly ask to see their intention, and when I asked her why it was 7 or 8, and she mentioned that although she had full intention, she was not sure if she could follow through the instructions and follow through the program. So she had quite low self confidence that she could actually do this work. So after the therapy, I did one full RTT session followed by a few counseling and coaching sessions because she needed a lot of help with psychoeducation and giving her practical tips on how to go with life from day-to-day basis, on a day-to-day basis. So here's what she says when asked for a feedback. So she had many therapists, especially for hypertonia and low muscle tone. And she had also done occupational therapy all throughout her school, speech therapy, and she was on medication for depression and sleep anxiety as well. So her previous experience with therapy has been traditional and been tough because oftentimes a therapist didn't give her the right tools to cope with the situation. So she needed more practical guidance. So when her best friend passed away, she didn't get the right tool to understand how to navigate grief effectively, or she didn't get the right therapy in school, understanding how to go from a special needs school to an actual world of adjusting to work with mainstream people. So now she's 26 and she is applying for jobs. So her experience with RTT and hypnotherapy has been really transformational with me. And she had slowly learned to become more confident, more better in handling her emotions. And with hypnotherapy, she's better in communication and going in depth with herself. That has been healing for her. So she also needed a lot of confidence and way to express herself. That was something she had a lot of difficulty with in the beginning. So in future, she wants to become more independent. So she still lives with her parents and she's looking for jobs. She wants to be more stable with life and thrive in her career, friendships, relationships with people. So in my observation, she was quite easy to hypnotize and she was more aware of her thoughts in the trance state. For example, if I asked her what was her thought when she had anxiety in the morning, she wouldn't be able to say that. But if I put under hypnosis and then I ask her to go to the time when she woke up and she was feeling anxious, and now look at the thought, what thought was she having? She would tell me. And during a trance state, she was really amazing in even understanding sometimes what my next question would be, like having this extra sensory perceptions I felt. And she was very clear. She could integrate ideas and come up with solutions by herself. But when she came out of that state, she wouldn't remember everything that she said or did, like all other people, most people do. So I have to remind her again. And then sometimes I have to also give her in writing, and she also takes note so that she can follow these instructions and she can remember what she herself came up with, that help to build her confidence and help to express herself freely. The good part is she's very dedicated, committed, and respectful in her approach, so that makes it easier to work with her. She maintains communication through written messages, clearly articulating her crisis situations, and she's also able to follow instructions and implement them independently, though she still struggles with recalling instructions. So I have to give things in writing and remind her a few times what we have discussed before. So she requires guidance for complex tasks such as scheduling our sessions because she's in a different country. So I have to check her time, my time, send her reminders. So she needs some assistance in that. But recently she moved to a new country and she became an independent entrepreneur. Also, she traveled alone abroad for the first time. She has also gained healthy weight and she continues to work on anxiety related to work and social interactions. She's still on medication, but her doses has been reduced under medical supervision. So here is an example of psychoeducation on Lisa and how she responds. So here I'm showing you an example where she's writing to me because she's feeling nervous about a job interview. But she also recognizes that she has applied to a sector where she was not even interested in. It's a real estate because there was good money. And her mom also recognizes that she is more creative in her approach, so this is not really her thing, but still she went on and she was feeling traumatized. So I give her some time to process those feelings after she writes to me, and then I write to her explaining what she's going through, the psychological pattern that she's going through. Here, like seeking out unconsciously familiar experiences to like self-fulfilling prophecy, and how this does not serve her anymore, and how she can break the cycles of trauma and look for more positive and new experience. So she understands that, and she writes back, "Hi, Dr. Sumita, what you are saying is so true. Thank you. Like you mentioned, I tend to seek trauma as comfort because it's a place where it's all too familiar. But like you said, we are breaking that cycle, allowing better things to appear. I managed to join dance class today. It was exciting and fun. The pace was a little too fast for me, and the class was quite big. So I will be looking for smaller classes and slower pace as I'm comfortable with that." So she writes about dance class because she loved dancing and singing and painting while she was young. But at the age of 6, when she was diagnosed with ID, she was moved to this special school. She gave up dancing, she became quiet, she gave up eating. So now she is getting back. She got healthy weight now and she's joining dance classes. And she's also understanding what works for her. And she's also asking for things that she feels comfortable with. So here's a statistical representation. I asked her questions from last year and this year again about few aspects of her life, and I gave scores for her to select where she falls in that scale. So to the statement, "My life has meaning and purpose," she gave 4 when she came first, and now it has improved to 8. And her sleep has also improved from 5 to 7. And other areas like I make good decisions and life choices, I recognize my limiting beliefs and take action, has also been improved quite a bit. She also accepts her a more lovable person. So with that, I thank you all for your attention. It's great that you all joined for this seminar today, and I'll be happy to answer your questions. You can also drop in the comment section below if you're listening to it on online on YouTube. There are also other experts in the forum who can also guide you. And if you are struggling with ID, intellectual disability, learning disability, or if you know somebody or have a child, or if you are a teacher, do reach out. There's hope, there's possibilities, and we must train these children to recognize their strength and not feel lost and despaired because they have to catch up with the mainstream education and mainstream students. There's already something there in them that they can pay attention to and they can shine. So also I tell a lot of stories to these kids, giving examples how people overcame difficulties and claim their life, claim their real power. So with that, I hope it helps a lot more people. And please drop your question in the comment section below. Share this with people whom you might feel benefit from this work and knowledge. Thank you all for joining. Thanks.